Shweta ji, you can start.
Namaste, everyone. I'm Shweta, and I'm part of Friends of India Society International. Friends of India Society International was established in the UK in April 1976 during the state of emergency in India that had led to suspension of democracy, curbing many fundamental rights of people and institutions in India. FISI is a non-profit international NGO and is a formidable voice for all India-related matters in the UK. Its ethos and objective is to promote India in the UK. It achieves that by highlighting India's achievements in various fields, including culture, sports, economics, and sciences. It achieves that by developing relationships with several diaspora organizations in the UK and providing a platform for them to come together. It also achieves that by engaging in seva work for the diaspora when required. Like during the initial phase of COVID-19, FISI had joined hands with Indian National Students Association and Seva UK to help many distressed Indian students and other Indian nationals who were visiting UK. They were anxious with the onset of the pandemic and were yearning to return back home to India, while the government of India was making arrangements in those stressful and difficult times. We had devised a two-tier structure wherein a frontline team responded to issues and queries raised by the students, which were then filtered to the next level of teams handling food, accommodation, legal, and medical issues. This arrangement reassured the students as many were psychologically overwhelmed. The team had attended about 1,500 calls, 1,200 emails, 3,000 meals were arranged, and 270 accommodation issues were sorted. An emergency medics teams was also in place to address any medical concerns. FISI team also similarly volunteered during the Ukraine crisis with Seva International to provide a helpline for students as they made their way to the western borders of Ukraine. FISI also aims to provide a platform to discuss various issues related to India and render a better understanding of the concerned topic and help address any gaps. In fact, today's conversation on how India faced the COVID pandemic is another such instance of FISI enabling conversations on India that reveal facts about the ground realities. As we all know, COVID pandemic has plagued the world over the last couple of years. India, owing to its size, population density, and relatively poor health facilities, seemed vulnerable and people expected it to collapse. Many prominent global voices and media houses came out with dire warnings regarding the same. And in the last 2 years, we've heard some disparaging stories on India's handling, like an article in New York Times that was titled Virus Strains, How Lockdown Spread COVID-19 in India, indicating that sudden lockdown announced by India wasn't in the best interest of migrant laborers. And the trains organized by Government of India ended up being the carriers of the virus. The article also said that COVID-19 task force in India was dominated by the upper caste Hindus. There were pictures of burning pyres that were awarded Pulitzer Prize, suggesting that only India suffered COVID devastatingly when millions were killed across the globe. Then there were many research papers and studies that put forth India's death toll many times higher than the official account. And also there were some articles and discussions pointing to the social behavior of Indians that had aided the COVID-19 spread in India. But what we have not heard enough, especially in international media, is India being home to 18% of the world's population, coped with 3 waves of the virus with one of the lowest fatality rates, that India's vaccination drive was unparalleled in scale and speed, driven by its indigenously made vaccines. India recently accomplished a feat of administering 2 billion vaccines, that India became the pharmacy of the world, providing life-saving drugs, medical equipments, and vaccines to other nations, and that India's economy thrived despite the pandemic. International Monetary Fund has projected that India would become a $5 trillion economy by 2026-27. So there are many such stories that demonstrated India's ability to rise to the challenge of such magnitude and achieve success on various accounts. And today we'll be talking about those stories and understand the unprecedented efforts that the country put in, led by Prime Minister Narendra Modi, and also get a grip on the lopsided narrative that surrounded India's COVID-19 situation. To help us draw a picture, we are so glad and fortunate to have Priyam Gandhi-Mody ji with us. She is a political communication strategist and author of the book, A Nation to Protect, leading India through the COVID crisis. The book is an exhaustive account of India's pandemic response. It documents how India stood tall, proving many skeptics wrong. This is Priyamji's third book, and it has been a bestseller for months now. She also frequently writes political nonfiction and lives in Mumbai. And to enable this conversation with her, we have Dr. Vijay Ranaji. He's a veteran journalist who was with BBC for over 2 decades. In his journalistic career, he has interviewed eminent leaders like Atal Bihari Vajpayee, Narasimha Rao, and Prime Minister Narendra Modi when he was the Chief Minister of Gujarat. He has contributed to India Today, Times, BBC Online, and several Hindi newspapers. He's also a historian and filmmaker and has made some beautiful documentary films, including one on the city of Benares that captured many aspects of the city, which one would not have seen in many films that were made on this city. A very warm welcome to our guest today. Without much ado, let's begin. Over to you, Vijayji. I think Vijayji, you're on mute.
Yeah, thank you, Shweta, and thank you, Fitzy, for giving me this opportunity to talk to a very prominent chronicler of our times. It's a pleasure to talk to you, Priyam Gandhi-Mody. But behind this personal pleasure is a sad story of unprecedented death and destruction. Can you hear me?
Yes, yes, okay? I can hear you.
Okay, right, okay. And the saddest part of this story is how some prominent Indians, politicians, propagandists, press people came together to make the situation worse, to exploit the pain and suffering of millions of Indians, and to insult and humiliate India in the eyes of the world. They clearly wanted India, and particularly the Prime Minister Narendra Modi, to fail. So India's COVID story becomes perhaps the most compelling and most unfortunate story since the partition of India. And it was important that this story must have been recorded for future generations so that they remain vigilant. Priyam Gandhi-Mody, tell me what motivated you to write this book, A Nation to Protect, Leading India Through the COVID Crisis. Priyam.
Yes. First of all, namaste and good evening to everybody, all our listeners and everybody who has connected with us. And to answer your question, Vijayji, that very early on in the pandemic, the negative narrative had taken on place very early on. With the migrants issue, there were rumors being spread, even pre-lockdown actually, but especially when the lockdown started, when the national lockdown was announced, most of our states had already gotten into some form of curfew or some form of lockdown. Despite that, the negative narrative aimed at the center, at the prime minister, kind of just wanting to negate all of those efforts, in the name of migrants. The way the migrants issue was shown in all kinds of media, be it social media, be it the video, the news, the popular print media, it was just very incorrect. Okay, and it was far from reality because the real actual side just never came out. And that's sort of around the time when I kind of decided that what the government is actually doing to protect the citizens is not really coming through, and the popular media is just kind of passing it off as this meeting was held and that meeting was held, and really concentrating on just a section of the population, and not really concentrating on the bigger efforts and the more complicated efforts of the Indian government to save 1.4 billion people. So that's when I kind of decided that this needs to be chronicled, not just to, set the tone right, but also for the future. It's also a record for the future as to how the government handled the pandemic from a top-down approach, and what the Prime Minister was sort of thinking at a time like this. No Indian Prime Minister has had to face a crisis of this nature before. It's a once-in-a-century pandemic. So what Prime Minister Modi was actually thinking, and how his policies sort of trickled down to the last Indian on the ground. And this needed to be chronicled, and that's why I wrote the book.
Interesting. And in the process, you met Prime Minister Narendra Modi. How comfortable he was to talk to somebody who was recording his plus and minuses during this crisis?
So I was able to ask him, quite candid questions, and one of the questions that I sort of asked him was that at any point in time, especially in the early days of the pandemic, was he scared and worried that he's not going to be able to save lives? And did he really think that, that we'll see Indians dying on the streets, which really was what the global community, parts of the global community was thinking? And he was absolutely confident in his team's ability to come out of this crisis because, and I'll tell you why. So he said that when he took office in 2014, he has been working on bringing the bureaucracy together and getting them to work together. Because our bureaucracy, and in his words, I quote him, he says that our bureaucracy is file sensitive and not life sensitive. And that since 2014, he has been trying to make them, work together across departments. So very early on in the pandemic, he sort of was prepared that he knew that these 7 years of training the bureaucracy will now finally, come to fruition, where they will all work together. Every arm, every department of the government will work together, to help India come out of this. So he was very confident in his people, in his team, in himself. So I think that was really positive. That was a very, very positive takeaway.
Prime Minister normally looks very serious and he has an image of toughness. How comfortable he was answering you, or how comfortable you were asking him some tough questions? Yeah.
Okay, so I'm going to be very candid here, that when I went for the meeting, I didn't really have any prepared list of questions or anything, because the general belief, like you said about the Prime Minister, that he's very tough, and I thought he'd probably give me a couple of minutes, because after all, he's the Prime Minister of India, and then I'll just listen to what he has to say, and then I will be asked to excuse myself. But when I went in, I was so surprised to find how approachable he was. He's a great listener. He's a great conversationalist. We were able to have a very lengthy conversation on a wide range of, subjects and issues. And I was able to ask him questions on his vulnerabilities. And he was so comfortable talking about it. So it was such a pleasant surprise, to speak to him and to see him like that. To break that image that the media has built of him, that he's an autocrat, he's not going to let you talk, he makes single-handed decisions, he doesn't let anybody else speak. So, all of those notions were like very quickly shattered within 10 minutes of going into that meeting.
Let's come to the exact story, COVID story. The first lockdown was imposed without enough preparations. It came all of a sudden, and there was a lot of flack he had to suffer. Though it later on, everybody knew that we did much better because of the strict lockdown. So how have you tackled the story of the first lockdown in your book?
Right. So, sometime in the middle of March, when the states had just about started to put some restrictions on schools and colleges, retail stores, malls, etc., there was a meeting that was held in the Prime Minister's office where all of the senior bureaucrats were present, and all of them in one single voice, after listening to opinions from our senior established doctors and everything, in India, global community, in a single voice, they recommended to him that, sir, we advise that we go under an immediate lockdown. So we advise that you lock down tomorrow. And the Prime Minister said, no, we cannot do that, because there are going to be people who absolutely need to, reach somewhere. Maybe there are parents, who are very old, they're living in other cities. There could be children who are living in hostels, in a different city. We cannot lock down immediately the following day. That was his first point. The second point was, do we know if people want us to make such decisions, such strict, stringent decisions? on their movement. We need to find out if this is what the people of the country want. And that's when he recommended that we do a one-day Janta curfew to see the people's response to curtailing of movement. And that's when he came up with the concept of Janta curfew. This is why Janta curfew happened, which was a one-day restriction on movement. And when they saw that overwhelming response from all parts of the country, from all sections of the society, that's when he knew, okay, people are afraid. They want their leader to make decisive, take decisive steps and help them protect themselves against this unknown enemy. And that's when he announced the nationwide lockdown after the success of the Janta curfew.
Now it created another unforeseen crisis, the migrant exodus. And interestingly, some of the state chief ministers played a very, very kind of controversial role in this. You know that how Delhi buses left everybody on the border of Uttar Pradesh, all these migrant laborers from Bihar and UP. So how have you recorded this event? And it's created unprecedented scenes, people on the roads, somebody lifting their wife and, on the back. It created, that's where these images of COVID started coming in. And they were very defining images because images were creating a narrative in those times. So how have you tackled those, that first migrant exodus, particularly from Delhi?
Absolutely. So this wasn't really, I don't want to call it unforeseen because we knew that there are going to be migrants who are going to want to go back, okay? But because we had no idea about how the disease spreads, we had no, very little information about the virus, about how, its character, the treatments, even any protective gear like masks, PPE kits, even testing kits, we had none of that at that point in time. The little bit that we were able to procure or manufacture or source or use from our reserves was mostly going to urban centers. Okay, so we had some confidence that if there's going to be spread of the disease, we will be able to save lives in urban areas. But if these people if the disease starts spreading very, very rapidly in the rural and semi-rural parts of the country, we're going to see a lot of lives lost. And that was just simply not affordable for us. That was simply not acceptable to the Prime Minister. He just did not, and to our government, and to kind of mitigate that, they chose that, they were very well aware that people are going to have to make adjustments and very severe adjustments, but stay where they are in the cities. We simply could not let them leave the cities. However, like you said, there were some state governments like Maharashtra, Delhi, who sort of motivated these migrants and facilitated their movement despite the very, very heavy risks, for political gain. And the media sort of just lapped that up, and that was very unfortunate. But we have to consider that when the Indian government announced the national lockdown, they knew that the very basic needs of food will be taken care of in the free food grain program that the government announced the very next day after the national lockdown. So nobody was going to go hungry, and truly over 2 years of the pandemic, we've not seen even one registered death out of starvation.
And then there was criticism that lockdown has destroyed the economy, and especially opposition leaders, particularly Rahul Gandhi, was very harsh that government has flattened the wrong curve, and several other opposition leaders were also making this kind of criticism. How much damage it did to the economy? Was it real or?
Yeah, absolutely. I mean, there was a choice. We had to make a choice between lives and livelihoods. But once again, the Prime Minister was so certain that livelihoods can follow, jaan hai to jahan hai, his very popular line that, simply said, Indian lives were not cheap for him, and he was not willing to lose any of them, so he very well knew that locking down entirely was going to bring a complete screeching halt to the Indian economy. But having said that, what Mr. Rahul Gandhi also and some of his team members and opposition leaders tweeted that he flattened the wrong curve, that is incorrect information, because the lockdown also flattened the COVID curve, and that's exactly what the lockdown was aimed at doing. Yes, it did, it did sort of flatten the economy. It brought it to a screeching halt, but we knew that, we were prepared for that, and we had steps in place to kickstart it when the Indian government began to unlock.
During the first wave, we came out relatively not too damaged. And in fact, it gave us, especially a lot of people, it gave us a kind of a overconfidence. People were openly arguing that Indians have a better immunity than the Westerners, that we don't need masks, we live in open spaces. So were we overconfident? When the second wave came, people were not simply prepared to heed the government advice and take the crisis seriously. So were we suffering from this overconfidence that we have better immunity? Some people were using these kalas and all these things and getting into the false sense of security. So what was the public mindset at that time when we were heading towards the second wave?
So a bunch of things, a bunch of things culminated into how the second wave started. One is, yes, people were overconfident that, we've sort of sailed through the first one, so we'll sail through the second one as well. The second was that the news of the vaccine was coming in, that the vaccine is available and, it's going to become available to all of us very soon. So that gave people even more confidence. The third thing is fatigue, pandemic fatigue. People had not traveled, people's businesses were slow, the economy was just slowly starting to pick up. So people simply just did not want to shut shop again. So they wanted to grab that opportunity, be out and about, travel. So the pandemic fatigue had gotten to them as well. And the fourth thing is really negligence in tracking these cases on local levels. So, for instance, a doctor from Maharashtra's COVID task force very candidly admitted to me that we were not tracking the variants. And only when a group of doctors came to us complaining that in these two certain regions of Maharashtra, we are seeing a change in a pattern of symptoms. We are seeing that entire families are, infected with the virus, and then even the neighborhood, the infection rate is very high, and there are very few people who are not getting infected in the house. Like out of 6 people, for instance, 5 people have COVID together in the house. So it seems that the virus had gotten more transmissible, and also the oxygen levels were dropping drastically. So when they saw the change in symptoms during practice, during their normal course of practice, that's when they reported it back to the government. And that's when the government woke up and said, okay, this looks like a different variant, let's test it. And by then it was too late, because we were already at the stage of community transmission of the very fatal Delta variant. So, some slack, from local and state governments, I would attribute it to.
This second wave, especially this Delta variant, and my maybe unproven or not much worked about, my thesis that during the January, a lot of farmers, a lot of people from Britain and Canada and America have gone to join the farmers movement. And everybody knew the Delta variant emerged, one of the first country it emerged was Britain. So who was responsible for spreading this wave? Because then everything was put on election rallies and Kumbh Mela. So were the farmers traveling from abroad, or these election rallies, or this Kumbh Mela? What really caused what was the process that the second wave arrived in India and which proved so fatal?
Right. You're absolutely right, Mr. Rana. So, as you know, the farmers' protest started sometime in the last week of November, and by January there was a very, very large rolling crowd in and out of Delhi. Now, a lot of these farmers from Punjab, Haryana, Western Uttar Pradesh, especially Punjab, they would go back to the villages, send another family member to Delhi. That family member would go back to the village, send somebody else to Delhi. So it was a very rolling crowd. And like you said, the not the Delta, the Beta variant was very prominent in the UK at that point in time. We also had the original variant that was still circulating in the Indian population. So with that, with these two variants then circulating in that protester crowd, we did see a spike. So there are these graphs that I've put in my book, which very clearly demonstrate that the second wave first started in Punjab, Delhi, Haryana, and parts of Uttar Pradesh, and then the spike in Maharashtra happened. So the Delta variant first originated in Maharashtra. There's no doubt about that. But we did start seeing a spike in cases. Like the fall after the first wave started to decline and sort of plateau in Punjab, Delhi, Haryana, and Western Uttar Pradesh first. So that was a clear data set that showed that it is the farmers' protest that led to the second wave in India.
And was it, and how far these election rallies and Kumbh Mela was responsible?
So by the time, once again, we were too late. The elections were already announced, and no party, absolutely no political party, withdrew from campaigning or decided to hold virtual campaigns. Now, I'll also give you an example. Before those elections, sometime in October 2020, the Bihar elections was scheduled. So the Election Commission had called for a meeting of all parties and had requested them to adopt a virtual campaigning method since we are in the pandemic. And by then, Mr. Amit Shah and the BJP had already held a round of virtual campaigns in Bihar, and very successfully so. They had installed, screens, at various places, and they had held already a very successful round. So in that meeting with the Election Commission, it is the opposition parties, the RJD and the Congress, who refuted and said we would be at a disadvantage in adopting virtual means of rallying, of campaigning. So we will not accept this. It is the opposition that denied, virtual rallies, and then, the Election Commission just went with the flow. And then, obviously, the Bihar election happened, and we didn't see a spike in COVID cases then because we were generally, we were going through that downward slope after the first wave during the Bihar election. But in March, 2020, when the rallies for West Bengal and, all of these states started, we were anyway, because of the farmers' protest, we were seeing a rise in cases of the second wave, plus the rallies just sort of added to it. And, it is what it is.
When the second wave worsened, the situation was really grave. There was no beds in hospitals. People were dying in hospital, outside hospitals. There was a lack of oxygen. There was scarcity of almost every kind. And then came this oxygen crisis, which made the situation really, really worse. How have you tackled this oxygen crisis, which at one point it looked that the situation is going to be really, really scary, and then government, moved things so quickly. So tell me the worst part and the best part of this oxygen story.
So from the beginning, when, and this is the science behind it, when a new variant starts to spread in a population, you really don't know the characteristics and the effect on the people until it's already spreading in the people. Okay, until you see similar clinical symptoms. By then, we are already at the community transmission stage. So by the time we realize that it's the oxygen that was being required in very large quantities in those affected with the Delta variant, the virus had already begun to spread very rapidly in the community. Having said that, as you know, most of our oxygen generation happens on the east coast of the country. The concentration of cases during the second wave was in the west coast, so in Maharashtra, or in the western coastline and north. So to transport that oxygen from the east coast to those parts was taking anywhere from 6 to 8 days by road. So the government had to very quickly figure out alternatives because 6 to 8 days was just simply not going to cut it. So they had to figure out how to do this. So they couldn't use the Air Force to lift the full tanks because it's flammable. So they used the Air Force to send back the empty tankers, and then they figured out a way to send the full tankers by rail, and that also by certain routes. And eventually they were able to reduce that time, to 1 to 2 days, depending on where the oxygen needed to be sent. Now, they also set up this group of bureaucrats that were in touch with every every team in every state, and they had a dynamic formula that depending on the caseload, that state will get an X quantity of oxygen allotted to them, because obviously we were in very, it was crunch time. But states like Delhi, the way Mr. Kejriwal has mismanaged the oxygen, it is absolutely despicable. And I said this repeatedly multiple times, even in my book, that and this is what even the Supreme Court Task Force has said, that Delhi required 5 times more oxygen than even other opposition states like Maharashtra did with the same caseload. So what were they doing with all of that oxygen? They have no accountability of how much was going to the hospitals, nursing homes, refillers, black market. They have no accountability of it. There was a point in time where they were demanding all that oxygen from port, and the oxygen manufacturers would send the oxygen to them. They would hold on to the tankers for 2 to 3 days, unable to empty them because they already had enough oxygen, and they would send full tankers back, but would still keep demanding more and more from the Supreme Court. So imagine, the officers who were working on the oxygen distribution at such a difficult time for the country, they had to spend, 3 to 4 hours every morning sitting through the, court hearings, alongside working on trying to distribute oxygen evenly throughout the country. So once again, I repeatedly asked that question, that all those extra lives that could have been saved in other states because, of really hoarding that 5 times extra oxygen, who's going to take responsibility? Is there any accountability?
This is the saddest part of the story, that India was having perhaps the worst crisis in its national history, and yet politicians were playing politics. Tell me, was there any opposition leader in India who went to Prime Minister, the Prime Minister, this is a national calamity, and let us come together and help you out in this crisis? Was there any opposition leader trying to alleviate the situation rather than making it complicated and difficult?
Not at all. I mean, very little. I mean, even if they did it, they did it for political gain. For instance, I remember during the migrants crisis, Mrs. Priyanka Vadra offered to send buses to Rajasthan to transport the migrants back to Uttar Pradesh. Now, when the UP government asked for a list of those 1,000 buses, she had offered to send 1,000 buses. And, in that showmanship style, she said, we're just doing this, to work with the country, to help the country. Even if the BJP wants to put their banner on the buses, that's fine. Full showmanship. And when the UP government said, fine, for security reasons, could you give us a list of the, numbers of those 1,000 buses? That would be very helpful. When they received the list, those vehicles were not even buses. There were just a few buses, and the rest were trucks, auto rickshaws, two-wheelers, and that would become a security issue, obviously, for a state. So then the UP government had to reject it, and that's when Mrs. Gandhi withdrew her buses that she had gotten parked at the Rajasthan border. So these kinds of, very dirty politicking happen, even with respect to, the PM Cares Fund. The controversy about the PM Cares Fund and Mrs. Sonia Gandhi writing to the Prime Minister saying that he should transfer all that money to the Prime Minister's National Relief Fund, when until very recently, she was a trustee of the Prime Minister's National Relief Fund. So why would Prime Minister Modi, at such a difficult time for the country, transfer funds that were meant for COVID relief to something where he would need Mrs. Gandhi's permission to use that money?
Sad indeed, yeah, sad. Let's discuss the role of media here. For a section of media, it was an opportunity to beat Prime Minister Modi. A couple of journalists were broadcasting live from cremation grounds, flying drones over cremation grounds. An American reporter called the scenes of these burning pyres as stunning. Some of the Indian journalists were popping on foreign television channels and calling it as a genocide. They were calling Prime Minister Modi as mass murderer. I remember one Indian journalist, a very prominent Indian journalist, in one day she appeared on all the 4 British channels, the BBC, ITV, Channel 4 and Channel 5, also on Al Jazeera, clearly saying this is mass murder. They've completely lost the sense of balance, and how could journalists behave like this?
Look, the journalists that we are talking about who abused even her father's death for popularity and narrative setting, it's absolutely cringeworthy. Like, role of such journalists absolutely cringeworthy. But I also want to say that it's the Indian journalists, when we talk about the role of the media, the Indian journalists, sections of Indian journalists lost loyalty to our country far more quickly than journalists of other countries. We have seen stories come out of the US and Spain and parts of Europe and the UK that entire nursing homes were wiped out because of the virus. People were not getting space to cremate for weeks on end. Ambulances were just stuffed with coffins. However, why are their premiers not termed as mass murderers? Because their journalists stayed loyal to their countries as compared to ours. It's absolutely unfortunate, but that's how it transpired. And this sick narrative of building of Hindu pyres. Didn't people of other religions die in India? They did, but it's this narrative setting of the pyre burning. Now, think about it. A Hindu pyre takes anywhere from 3 to 4 hours to burn. Obviously, in the middle of a severe wave of a pandemic, there is going to be an increase in the number of deaths. So obviously, there are going to be more cremations. Plus, not all crematoriums were given permission to cremate COVID patients. So there were just a few crematoriums in certain districts and cities that were given permission to cremate COVID patients. And obviously, there was an increase in death rate because we were in the middle of the surge. Plus, Hindu cremations take over 3 to 5 hours, plus the whole, the fire and all of that, it's very dramatic as compared to, dig and bury. So, I mean, it's very sinister, but unfortunately, that we had to go through that and we had to see that playing out in the global media.
And I, being a journalist myself, for almost entire life, I did not see one journalist telling his or her audiences that this is a situation beyond control. This has never happened in human history. So let's come together and face it jointly rather than fighting at this crucial moment. Now, let's come to the vaccine story. Again, it all started in controversies. One politician says that this is a BJP vaccine. while they say initially, in fact, that some prominent politicians were saying, why are you in such a hurry? Why are you giving emergency approval to these vaccine manufacturers? There were accusations that government is trying to benefit these manufacturers. And then there was criticism that, it will take about 15 years to vaccinate the entire country. And in the middle, there came an argument that why government of India is buying itself. Why can't we go to Pfizer and buy them directly? In fact, lots of chief ministers were saying in public that as if vaccine they can buy off the shelf, they can go to Pfizer and say, okay, we want 1 million vaccines. So they were making it, they were narrative setting, they're making it worse for the government of India. So tell me how this criticism, and then it was a huge success story. Entire world accepted what India did was extremely unlikely and clearly remarkable. So tell me this vaccine story, how it evolved and how it culminated.
So in April 2020, first week of April 2020, the Prime Minister held his first meeting on the development and acquisition of vaccines. That is less than a few weeks after the national lockdown. And we already had a few candidates. We already knew, the direction we were going to go in. So he has been personally involved in this vaccine manufacturing, acquiring, distribution, administering. This entire vaccine story, he has been personally supervising it right from April 2020. Having said that, this is the first time in the history of India that this kind of risk funding has been undertaken. That the government of India has for the very first time has taken a risk on private manufacturers to help them sort of build capacity to make enough vaccines for 1.4 billion people. We've all heard of Operation Warp Speed that President Donald Trump had announced in the US. Obviously, we don't have those kinds of billions of dollars to risk. So what we did is that we did this in parts. We first funded an X amount. When we had proof of concept, we then funded, we then put in more money for capacity building and, for those companies to buy the raw material. And then those companies would manufacture in the required quantities. Now, between that, the gap, that's where we saw that shortage arise in those 2 to 3 months, because they were trying to fill that gap, because that's when they got the money from the government to sort of scale up in quantities that would be enough for all of us. The government of India knew that, and when they went in, when the vaccines became available, they knew very well that this was going to be, that we were going to see a very, very heavy supply towards the end of the year. And that's why they were so confident in Supreme Court that they will be able to vaccinate all Indian adults by the end of the year, which they kind of almost did. However, like you said, there was politicization of the narrative. There was one MP who said that, what is the rush? Why have you given approval to Bharat Biotech's vaccine, which is our made in India vaccine? At that point, the thinking of the scientists and the core task force was that they were very well aware that there were variants that were combining in the farmers' protest sites. And there was a small chance, it was small, but there was a small chance that the Covishield vaccine might not be effective if there was going to be a new variant that was, that was going to be different. So to cover ourselves from all sides, and they had enough data from safety and efficacy data from Bharat Biotech to be able to make that decision confidently. And that time, obviously, you have to weigh, what's best for the country.
There's another intriguing aspect, and a lot of people still have no answer to it. Can you shed some?
Actually, sorry, can I go back to that question?
Yes.
Also,
Yes.
I totally forgot to put this out there,
Yes.
that while we were focusing on manufacturing our own vaccines, or vaccines made in India, we were simultaneously having conversations with the foreign vaccine manufacturers like Pfizer and Moderna and Johnson and Sputnik. Out of this, the big guys, the big fish, they agreed to give us 5 crore vaccine doses in the entire year of 2021. Only 5 crore. We are 140 crore people. And it was priced at a ridiculous price. Plus, they wanted legal indemnity, not just for that company, but for the entire chain. So the stockists, the transport guys, everybody had to be indemnified legally. Plus, they wanted the government of India to mortgage sovereign properties internationally. So, which meant that if they would default on the timelines, so maybe even if they weren't able to provide, say, the 5 crore vaccine doses in 2021 and they defaulted on the timeline, and they provided it to us much later, we would still have to take it at the price that we committed. If not, we would essentially be giving them the right to take over, say, our embassy building, some Indian planes, So they wanted that kind of waiver, and that was just simply not acceptable to us.
Yeah, it must have been so humiliating, and thank heavens that we have scientists and we have indigenous capacities to take care of ourselves, and we in the end became the savior of the world, through our Indian vaccine. And there's another aspect of it, and there are still no answers. During the second wave, the Prime Minister was not publicly visible for a few weeks, I think for about 3 weeks. And there was a lot of criticism. What was happening to him? Did you have time to ask?
Yeah, I mean, so he has really been of this opinion, even to the point when I began to write the book, that until the country was secure, until he was confident that the country is secure, he really did not want to come out and play politics, or come out and refute the accusations, and whatnot. So he remained at the back, quietly working, holding one meeting after the other. In fact, a very senior PMO official said to me that we were all going to those meetings one after the other, and we were just getting so exhausted just listening to all of that news coming in and that information overload coming in, that we would get very mentally and physically exhausted. The Prime Minister would just keep on going, solving one issue after the other. So, he was just determined, and he really just wanted to get the country out of this as safely as possible, versus coming on and refuting some of these accusations.
Yeah, he's indeed a hard worker. Everybody knows how hard he works. And it was almost impossible to imagine that when this crisis was happening, he was just sitting and doing nothing. So again, a frivolous condemnation or criticism. Now, finally, let's come to the final death toll. The government of India said it was about 5.2 lakhs, whereas WHO and some other organizations put the figure almost 10 times high. And during the COVID, people were, making wild estimates up to 30 million deaths. Some of the epidemiologists were saying. So finally, where do you settle in this controversy? What your book says about it?
So, to just get it out there, the study that the WHO came out with was so statistically incorrect that now they've withdrawn it. They've withdrawn those numbers, first of all. Second, the way it was announced. If you look at the entire global picture, that China, bigger cities in China were going under lockdown. Before announcing the study, they first leaked it out to the New York Times. And they only leaked out the India figures, that India is stopping the numbers from coming out, and all of that. So it made a huge, they basically kind of, the global community began to accuse India that it's because of us that most of the excess mortality is undercounted. Okay. When we refuted it and we explained to them how we collect death data from ground up, that it is almost impossible to conspire to artificially fudge those numbers, because they literally come to us from every district and every local rural area, and then it gets collated at the center, and that's what we share. Yes, there may be delays in people coming and registering the deaths of their loved ones, and maybe we see that delay in the data coming, but we definitely don't fudge. So we explain to them. Second, the model that some of these studies used to calculate excessive mortality is a model that was based on a small area in South America. For a huge country like ours, those models don't work, just because of the geographic, length and breadth of our country, and just the changes in population density and the impact of COVID at different times, through the country. So those models don't work. So eventually, the WHO, they have a gap that there could have been, say, first they said, there could have been 30 lakh deaths to 50 lakh deaths. Then they changed that gap to some 20 lakh deaths to 50 lakh deaths. Then they changed that to some 10 lakh deaths to 50 lakh deaths. So it is a study that cannot be replicated by any other team of scientists. And, when a study cannot be replicated by any team of scientists to show, the same range, obviously it lacks in scientific rigor. And not just we, many other countries also complain to them, and which is why they've withdrawn it. Even more oddly is that in their numbers, India, obviously, they said had 10 times more deaths. They said China had negative mortality during the pandemic. So it seems like a very motivated and biased study, solely aimed at, disturbing our global reputation of pandemic handling.
Finally, what have we learned from this tragedy as a nation?
As a nation, I think one of the biggest learnings should be that political differences have to be kept aside to save people's lives. Second, I think our other learning is that if there wasn't Prime Minister Modi driving the response from the front, and if it was somebody like some of our past prime ministers that we've seen, or those who are aspiring to be prime ministers from the opposition, we would have been, the global community, we would really be in that situation where we would have seen piles of dead bodies on our streets. We really would have seen that kind of situation. So I think the biggest learning is to elect your leader very, very responsibly. So I think these two, and third, obviously, that bureaucracy has to work together in times of crisis. It can't be a one or two department issue. It has to be a whole of government issue, to come out of this kind of crisis. And lastly, I think self-belief that India is capable of emerging out of a crisis by itself with Atmanirbhar policies. If we are good enough, if our policies and if our materials and if our work and our products are good enough for 1.4 billion people, they are good enough for the world. And we can see that, in the way that India has sort of plugged itself into supply chains, into global supply chains post-pandemic. And we see that rising stature of our country. So I think self-reliance
Thank you, Priyam. Gandhi-Mody. A nation to protect, leading India through the COVID crisis must be a very important chronicle of our times. And we really needed somebody to record this history for the future generations, because God forbid, these kind of scenes and times are seen again in near future. Thank you very much indeed. And I'll now open the floor for some questions, audience questions.
Sure.
So you're all invited to throw your questions to Priyam.
Do we have any?
Yeah, do we have a hello? Any questions? Yeah, vaccine naysayers, what was that one of the factors of the devastating second wave? As it aided the vaccine hesitancy among people?
At that point in time, we didn't have enough vaccines to vaccinate a large part of our population anyway. So having said that, and despite that, our government did take very early steps to quell any vaccine hesitancy that was fueled by some of the opposition leaders, and we see that data. Like for instance, Mr. Akhilesh Yadav had said that I'm not going to take the vaccine because it's the BJP's vaccine. Now, how we see that play out in terms of data is that in the Samajwadi Party strongholds, we saw greater hesitancy in terms of what we saw in the data until Mr. Yadav and his father came out publicly and took the vaccine. So there was definitely impact of political heads criticizing the vaccines, and that had to be dealt with more information. In fact, the Prime Minister's picture on the vaccine certificate helped a great deal to quell rumors and hesitancy in the very, very rural parts of the country.
Interestingly, that was the picture which was criticized the most. And Jayu Shah sends a comment. I'm glad you mentioned how Indian journalists' behavior during the COVID and the cremations. The tragedy is that Indian politicians go abroad and abuse anti-Modi and spread anti-Modi feelings. How many Westerners abuse their own country? And he says, I'm looking forward to read your book. And Bharat Shahji has also, Bharatji, why don't you ask your question directly?
Phone karo 5 minute ma. Let me unmute.
Yes.
I'm unmuted. I'll come on the video as well, if I may.
Yes, yes.
Am I there?
Yes, you're there. Yeah.
Namaste.
Nice to see you. Yes.
Namaste.
Very, 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 very interesting presentation. Thank you for taking the time and trouble.
Thank you. Thank you for being part of it.
We are very aware of what India has tried to do. But I am born Kenya, Mombasa, brought up there, never been to India until I was 26. So I don't know India in the way you all might know. Yet, like Jayubhai or me, who were brought up in an environment where there was very little, I believe India extended a helping hand to a lot of countries around the world.
Yes.
Did you manage to kind of comprehend how far this had been done?
Yes, and we were one of the first countries to bring to the table in the World Trade Organization negotiations that IP rights on vaccines should be waived. And we fought till the very end, until last month when they were finally waived. So the Prime Minister always believed that if our people are getting the vaccine, then the countries that are not manufacturing them, or they are not able to acquire them at the high prices that some of these other companies were offering them at, those people should also be getting the vaccines. And which is why, the Vaccine Maitri, which is a vaccine diplomacy program, was started. Obviously, we had to halt it due to the severity of the second wave, plus plus the demand from the opposition and all of that. But we were able to restart it, as quickly as possible. And interestingly, we were able to enter very strategic markets that used to be closed to the Indian pharmaceutical industry, until then. So it also has strategic advantages.
I asked this question deliberately because I am aware that our so-called border neighbor, China, has deep roots and penetration across Africa, particularly. Yet there's a lot of Indian people there, and I'm hoping that as a result, the diplomacy angle to this, opening of the markets as well, and as we might have now seen and heard about Sri Lanka suffering, but also other countries around Africa are being subjected to a lot of financial burdens.
Yeah. So apart from the vaccines, also the fact that we were exporting a lot of food to some of these countries that weren't making enough quantities of pulses and food grains, that also helped. For instance, the UAE.
Thank you.
Any more questions? Yes, Santosh Patil. Question 1. How will this book be made available to UK or foreign countries? And post this COVID?
The Kindle version is available, so that can be purchased on Amazon. Unfortunately, we're still trying to figure out a way to get the hard copies there.
And what has India done? Was it recognized? India's contribution, was it recognized anywhere else in other countries or international fora?
Yeah, absolutely. I mean, it is for everyone to see. The fact that we have, today we stand more secure. We vaccinated, 200 crore people. We've given out 200 crore jabs for, it is definitely recognized, that kind of scale, that, it's not just a number. It means that many doses, it means that many shots in arms. We're also seeing the state of the pandemic in other countries. For instance, even today, as we speak, President Biden is infected with COVID despite taking 2 shots and 2 boosters. So we clearly see that the effectiveness of the Made in India vaccine is far more than some of these other vaccines. We also don't boost and reboost and triple boost and boost again and again. We don't feel the need to do that, because I believe that our technology and our vaccines are far more they're more effective.
This was the question from Santosh Patil ji. Now, Jayu Shah has also raised his hand. Jayu bhai.
Namaste. I'm so glad that you've written this book on COVID and everything about Modi ji and things. Because somebody like me who has defended Modi ji since Gujarat's days and oral in media here as much as, because he was one guy who has done so much for India that I'm glad somebody from a factual point and truthful book has been written. So we can literally present these books to politicians in Europe and America and say to them, read the truth.
Yes, absolutely.
That's my comment.
Thank
Sorry.
you.
No, thank you. Thank you.
It's a helpful comment. Thank you. Any more questions? I think we have to wrap up the program now. May I hand it over to Manuji now?
Namaste, Vijayji, and namaste, Priyamji. Vijayji, a very fantastically conducted session. It's a reflection of your years as journalist and, of course, your expertise and experience. Priyamji, thank you so much. Before I thank you, from behalf of FISI team, I would like to point out that there was a tweet by FISI on 9th of May 2020, and that went viral. And we had just shared the news about India becoming the second largest producer of PPE kits. I think around 200,000 PPE kits were being produced in a single day. The fact that the tweet went viral, and we still have a modest following on Twitter. It went viral because, you know, the people were really, really hungry for some good news, for some positivity.
Yes.
And as this session brought out that some of the Indian media houses and some Indian journalists were only adding to the panic. And I can safely say so on behalf of the British Indian diaspora that we were invested in what was happening in India. We had issues to deal with here, but then most of us have parents or extended family or friends in India, and we were following that story as well, extremely worried. So I think your book is that, you know, it's that perfect sort of something to go back to. You have chronicled, of course, a dark but a very important part of our history. We can read it, and we can, as pointed out by Vijayji also, it's going to restore our faith, and it's going to give us some hope and a lot of pride in the fact that India rose up and dealt with this adversity so strongly and so beautifully.
Yes.
So, Priyamji, thank you on behalf of the Friends of India Society team. I thank you for taking out your time.
I'm very humbled.
We look forward to reading your book. Thank you so much to you and to Vijayji. Thank you so much.
Thank you very much.
Namaste.
Thank you.
Thank you.
Are we okay?
Is live stopped?